Hello, and welcome to the Massachusetts SHINE program. SHINE stands for Serving the Health Insurance Needs of Everyone, meaning everyone on Medicare. We are part of the national network of 54 state health insurance programs, otherwise known as SHIPs. SHINE is funded by a federal grant from the Administration for Community Living. Our mission is to provide free, unbiased health insurance information, counseling, and assistance to all Massachusetts Medicare beneficiaries and their caregivers. So how does SHINE deliver services to the consumers of Massachusetts? We have 13 regional offices across the Commonwealth, as well as an office in Boston at the Greater Boston Chinese Golden Age Center. Under the direction of a regional director, certified SHINE counselors offer individual appointments as well as group educational sessions to Medicare beneficiaries at various locations in their community, including senior centers, community-based organizations, hospitals, clinics, senior housing, and independent living centers. We have over 700 counselors, about 60% of whom are volunteers who have been put through a rigorous 40-hour initial training program on Medicare and other public health benefits available to Medicare beneficiaries. They then need to pass a certification exam before they are allowed to begin counseling. This initial training is supplemented by regular continuing education and an annual recertification requirement. So what are some of the ways that a SHINE counselor can help you as a Medicare beneficiary? Here are just a few examples of the questions beneficiaries often ask us.
I'm planning to work past age 65. Do I still need to sign up for Medicare? Do I have to pay for Medicare? Does it cover everything? How does it compare to my current insurance? I don't take any medications. Do I really need to take a Medicare prescription drug coverage plan? I just received notice that I'm approved for Medicare now that I've received 24 months of Social Security disability payments. How can SHINE help me? I have medical coverage through the VA. Do I still need Medicare? I've been on a Health Connector plan and I've been receiving a tax subsidy. Now that I'm turning 65, can I just stay on my Health Connector plan? Am I covered by Medicare when I travel? There are so many options and choices when signing up for Medicare. How do I know which plan is best for me? I'm worried about the cost of health care as I age. Are there any programs that can help me?
The truth is, the answers to each of these questions can be very different for every individual that we counsel. And Medicare is complicated, even for those individuals who are used to dealing with complex issues. Even if you've started to do your own research, it's often helpful to check in with a SHINE counselor to make sure you're making the right coverage decisions for you. As a general rule of thumb, it's usually a good idea to make an appointment with a SHINE counselor a few months before you turn age 65 to review your situation and create an individualized plan for you. Around that time, you will likely be receiving an enormous number of mailings from insurance companies across the Commonwealth who are also very aware that you're turning 65. You may also hear directly from insurance brokers who will offer you assistance in selecting your Medicare coverage, although they may not be able to show you every option that's available to you. A SHINE counselor's only goal is to find the best coverage for you at the least cost. Our counselors show you every plan available to you as a Massachusetts resident. Our counselors receive nothing for helping you decide on a plan, other than the satisfaction of knowing they've guided you correctly based on your individual needs. And we also recommend that you return to SHINE once a year to see a counselor, even after you've started Medicare, during what is known as the Medicare Annual Open Enrollment Period. Why do we suggest that you return to see a SHINE counselor once a year? Because the prescription drug and health plan coverage plan you select one year may not be the best plan for you the following year. Your medical and prescription needs may change. Your doctors may change the rules in their practice regarding what plans they accept. And perhaps most important of all, prescription drug plans often change the drugs they carry in their formularies, as well as the tier levels and prices for those drugs. If you miss the opportunity to update your coverage, you may be stuck in the wrong plan for another year, and this can be a costly mistake for some.
So what's the best way to connect with a Shine counselor in Massachusetts? As we mentioned earlier, counselors are located at most councils on aging across the Commonwealth. During the COVID-19 public health emergency, and because many of these locations have been temporarily closed, counselors have shifted to a virtual counseling environment where sessions are conducted either by phone or over a web conferencing platform such as Zoom or WebEx. In order to make an appointment, consumers should first call the Council on Aging or Senior Center in their city or town and check to see when an appointment is available. Once these centers reopen, appointments will be held at these local sites, but until then, we can arrange to have a counselor call you and help you over the phone or on the web. If you're unsure of where to call, you can also call the Mass Options line at 800-243-4636, where a representative can direct you to the right phone number for the program in your region. You may also want to visit us online at our website, which is www.shinema.org, where you can request a call back from a Shine counselor. And lastly, you can email us at shine@mass.gov, and we will direct your inquiry to the appropriate regional program for a callback.
Remember, the Shine program is a free, confidential service that is here to help anyone in Massachusetts who needs assistance with their Medicare choices and decisions. We look forward to helping you in any way we can. Thank you.